Hello, my name is Lindsay Shuck. Thank you for joining today's Family Office Network's webinar series featuring OXIO Health. Before we jump into the presentation, I would like to take a minute to introduce our speakers. Noel Guillama, President of OXIO Health. Noel left his family construction business in his 20s when he became an angel investor in healthcare and found his true calling, and more than 30 years later has become his passion. He has built and spun off several healthcare companies, acquired and managed 40 medical practices, and was responsible for more than 40,000 managed care lives throughout the state of Florida. He is an inventor and responsible for 40 patents in healthcare. A true serial entrepreneur, he has taken 6 companies to public marketing, including 2 via IPO. Carl Larson, Executive Vice President and COO, is also with us. Carl has over 35 years of engineering and construction, owning as well as managing small and large startup organizations with upwards of 30 million in revenue and more than 350 employees. His broad and diverse experience ranges from the computer application development, nuclear power plant engineering and operation, owning several construction companies, to acquiring and operating a regional airline. He has more than 11 years in the healthcare industry, where he participated in a public healthcare e-commerce marketplace platform to bring transparency and cost competition to the delivery of medical care. Lastly, Greg Steinberg, outside board member and vice chair. Greg is currently the CEO of Greenway DNA, a DNA testing solutions provider. Greg was president of an early stage company that under his watch generated more than $2 billion in organic revenue, grew to over 2,000 employees, and was in the top 10 of the INC 500 for 2 consecutive years. Greg has been at the board and operating level in healthcare for over 15 years. At the end of today's presentation, we will have time for Q&A. Please use your questions chat option on your screen to submit your questions.
Thank you very much, Lindsay. We appreciate that great introduction, and we want to thank everyone for being with us, at least this afternoon here on the East Coast of the United States. We're here to talk about a really amazing opportunity that is also incredibly well-timed. We're going to take about 25-30 minutes to discuss the overall view, and then we'll be ready for your questions. Most of the presentation I will make, and then we can go through the Q&A. We're all living through a very tumultuous time, and almost all the headlines are negative. Not only in the economies globally, certainly the United States, but also even in healthcare. We have seen what has been a black swan event in healthcare that has, by definition, never been predicted, where literally not only do we have incredibly sick people and over 100,000 deaths, we also have an industry that has suffered dramatically. And at the same time, and we don't want to talk about it at this point, there's actually incredibly good news for the business of healthcare and for the opportunities in healthcare, and particularly around providing services, and we'll talk about later in our presentation, which is a capitation model instead of surviving on a fee-for-service model. And the other is on technology. Literally, we could talk about certainly the questions, the merger between Teladoc and Livongo, or the IPO last week of an amazing company called Oaktree that is very similar to what we're doing. We have a little bit more experience, certainly, and a lot more technology. But healthcare is going to return back to its baseline. It will continue to grow. Today, it's not only a $3.6 trillion industry, it is expected to literally double over the next decade. And in particularly, what is most important is the Medicare Advantage, which are those people over the age of 65 that qualify for effectively government health care. That number is also expected to increase by more than 100%. And in particularly, one of the things that's the most exciting is what is generally referred to as a capitated model. And then basically that model is where the insurance companies pay the providers a set rate. A few years ago, we were all witness to the creation of what became Haven Health, by three of the most respected entrepreneurs in the world. And their idea was that they wanted to change healthcare. They were going to literally be the change agent in healthcare. And we found out a few years later that they have not changed very much. And recently, there's been a lot of announcements about how many people have left and what are they really doing. A few days after that announcement, we wrote in our blog, and you can go check it. Literally, the reasons why they were not going to change. They were effectively creating a group purchasing organization, and frankly, in order to change healthcare, certainly the way we're seeing it, and 30 years of experience later, you have to literally touch the patient, and you have to, yes, have a lot of technology, but it really is not technology with healthcare. It's technology infused in healthcare, which is a completely different perspective. So we're going to talk about a couple of things that are very important. One is the difference between sort of that fee for service and the capitated or value-based care. The way that we in our model have put in the past and will put the patient in the future. And then when I talk about technology infused care, which is something that as of today is still missing. You either have technology companies or you have service companies. You have to bring them all together to make a big difference. We'll talk about the technology that we have actually developed, the certifications that we have had, and also the patents that we have licensed, and we'll continue to expand that ability. Also, bringing in the technology basically from the home, so that we believe that IoT and wearable devices are going to be fundamental to the future of healthcare. It's one of the things that we have learned effectively catastrophically with what's been going on with COVID. And then last and not least, and we'll talk about this, especially a perfect example is the Oak Street IPO last week, where over 50% of the company was owned by two venture capital companies. They did fantastic, great idea. But the challenge now, if you wanted to be in that space, you would have had to buy the IPO. And by the way, last time I looked, the IPO was up 100%. So what we're bringing is a different model for investors to come and invest into our company and also participate in those companies individually as well as collectively. And we'll talk about that, the exit strategy. In these next couple of slides, we want to talk to you about our experience in clinical operations and running MSOs or management service organizations, in running physician practices, and even be participating in the founding of two medical schools. Tremendous amount of experience in construction and development, acquiring real estate. That is fundamental to our vision, because we believe that you have to create standardization, just like you've created other standardization in the industry. Think about this. McDonald's does not adapt their facilities to whatever's available. They go in and they build exactly what they want and how they want. And that's why we see the future. So we're changing the way that the consumers interacted. We're changing the way they interact with technology, and we're changing where and they're giving care. With technology, we have the credentials, having built both EMRs by aggregating middleware and putting them together. We've aggregated billing systems. We have aggregated information management information systems, and we have actually built multiple systems. Also built, ancillary technology companies also in healthcare. So we bring tremendous experience into the use of technology in healthcare. And also, we obviously bring a material amount of experience in investments, in raising capital, and taking companies public, and growing companies from idea to $100 million, multiple IPOs, multiple reverse mergers, literally company on the Inc. 500. That's important because in healthcare, experience pays, and experience pays tremendously a dividend. How we got here is originally what is today OXIO, which we changed the name in January of this year, was the R&D arm of what is our largest shareholder, and it was designed to build the electronic medical record that we call POWER. By the way, POWER is fundamental both as a technology and as a philosophy. The acronym stands for Personal Wellness Electronic Record. We now see an opportunity to go into the service business, which is what we have been in the past, to provide care, as you heard Lindsay's talk about, literally 40,000 patients, bringing in technology and bringing in new and economic model. So what we have today is OXIO basically has 3 captive companies that will be used to provide services to effectively our portfolio of companies, or the 5 companies that we're briefly going to talk about. which is the one on the left is literally providing care on a real-time basis to patients. The second one is real estate. The other one is the health information system, way more than technology or an EMR. And then a couple of individual applications, which is the blockchain and IoT devices. The problem that we have in healthcare is we have had a system for the last 50 years that has been based on what I want to say today, a failed fee for service model. If the doctor does not touch the patient, the doctor cannot bill for that care. That has created all kinds of problems and has literally twisted an industry. And we believe that over the next decade, that we're going to go from effectively a 70-80% fee for service model to probably a 70-80% capitated or value-based care. The government wants it, and employers want it, and at the end of the day, even insurance company want it. So we're bringing a comprehensive solution that absolutely positively is patient-based, patient-centric, but we're bringing that technology to bear. That technology opportunity is just as big because for the last decade, we have seen between government and private industry put hundreds of billions of dollars into creating new technologies, and except for the hospital-based systems that I can tell them with one hand, which is Epic, Cerner, and Meditech, sort of Allscripts, the rest of the companies have been losing money because they have no pricing capacity. They are depending on the pay of the provider to pay for more technology because it has been a government mandate, instead of creating a technology that provides solutions. There is no Apple of healthcare. There is no Microsoft of healthcare. And frankly, in a different way, there's no Amazon of healthcare. That technology has created more silos, deeper silos. And the reality is that a doctor now has a problem in determining what's wrong with the patient when he has to go read through 30 pages of notes that were created to basically justify a medical transaction or a medical bill. We're looking at this completely different, and we are 100% confident that the proper use of technology ingrained in the service of the patient will dramatically change both the patient experience, the doctor's experience, and the payer, whether it's a government or insurance company. And at the end, part of our philosophy is to really empower the patient, enable the provider, and advance the science. We also, as we noted in our previous discussion, we've also seen, I've been part of two investment committees that endowments and major institutions have been making all the money with startups. I just talked about the Oak Street IPO, where the VCs that took the risk, put $400 million, ended up with over 50% of the company. So basically, at the end, they basically offered those companies to the public at large. And many times, even family office cannot access to these unless they're using intermediaries or they're using some kind of vehicle to get to them. We think that needs to be changed. We created something innovative, revolutionary, which is a distributive venture platform. And we'll talk about it a little bit later, that changes our design. It changes the opportunity to create value. And at the end of the day, it changes the opportunity to create liquidity for the investors. And we'll be happy to talk about that. Doctors, primary care doctors, are in a crisis. I talked to one this morning that literally says, Noel, I can hang out for a couple of more months, but I cannot survive this way. 20% of doctors are talking about literally closing their practice. 50% of primary care physicians were not prepared for financially for this pandemic. And you've got tremendous amount of stress and anxiety from even consumers, so that they're not seeing their doctors. Telemedicine has a role. And by the way, we're building a telemedicine portal into our EMR that'll probably be ready by, if not the end of the quarter, early into October. But telemedicine is not magic. It's not magic financially. It's not magic providing care. The magic of telemedicine is when you integrate it in an entire healthcare delivery system. So talk about our companies real quick. Total Care is literally our management service organization. We are going to acquire those doctors under stress, bring them into a company, take over their practice, take over their employees, which we've done over and over and over again, and concentrate, as I said earlier, in the Medicare Advantage field, which is going to continue to increase over the next decade. By 2030, all of the Medicare, all of the baby boomers will be in Medicare. So we think the opportunity for Medicare Advantage actually lies ahead of it, not behind it. The opportunity is to get between 8. Okay, Oak Tree announced that they were making about $12,000 on an annualized recurring revenue per patient. We will acquire practices, and we are confident that we will increase our revenue by 200% over the next 4 years. And we will bring in that technology that we already have, that we'll talk about it. We will begin in South Florida and expand into Florida. By the way, we will only work where we can control our environment. So there's some technical and legal prohibitions about doing our model in other states. We are not going to go there. I've been with companies that have contorted to do that, to make it work. And I can tell you from experience, from having lived through dozens of acquisitions, it doesn't work. We're also going to control our physical plant and facility where care is provided. And we're going to provide that to other doctors, not just to the ones that we acquire and we bring in. So think about it. Every time we acquire a doctor, they have about 2,000 square feet. They pay about $4,000 per month. We're going to combine them, aggregate them, create efficiencies, and bring them into our location. Plus, we're also going to offer some of our excess space by design to other doctors who can provide services to our patient. We're going to be able to provide high-end technology to not only our doctors, but also those doctors that become part of our business model. In South Florida alone, there's 18,000 doctors. We believe that we can attract a few hundred just in South Florida. After that, we will move into Central Florida, North Florida, and then probably go into Texas and other southern states. Why? Because that's where the population is growing. That's where the Medicare opportunity is. We have designed and built and certified electronic medical record. We understand the space. We know how to do it. And as I said, we're working on telemedicine, and we will have it way done before the end of this year. We literally had a demonstration yesterday from our development team. The opportunity in EMRs is not to selling EMRs. It is really about using the platform to make a practice much more effective, much more efficient, and be the change agent versus trying to sell it to individual physicians when in fact they don't have the, the, the ability to continue to pay more and more as government mandates more and more technology. So I expect that 2020 will be a pivotal year for technology companies that are in the wrong space or don't adapt. The future belongs to a technology-infused healthcare and to effectively capitation. With that knowledge in back, we've designed and we filed a patent for a blockchain-based electronic healthcare record or personal health record because we believe fundamentally, just like the P stands in power, is that in the next decade, consumers will control their electronic medical record and their information. And in some cases, they may wish to sell that information, uh, de-identified, obviously, for pharmaceutical research or for medical research. We think it's a tremendous opportunity, and it's one of maybe half a dozen applications that we're confident can be enhanced, made better or faster by the blockchain. So that's one of our other opportunities. Another one is we talk about IoT devices a lot, and recently I think everyone has heard about sort of 5G. Latest news yesterday was that sort of Apple's going to be coming out with a new 5G phone. 5G is going to dramatically change healthcare because you're going to be able to connect the patient real time and live so that effectively not only can we replace some of the in-office visits, we may replace some of the in-hospital visits and some of the in-hospital treatments. So one of the things that may happen, and we're predicting this in our blogs, and I urge you to go look at our website, is that patients will be discharged faster from the hospital, but they will be given literally a suite of connected devices that will allow the doctors to monitor them. And with home care, we will be able to, without question, increase the quality of care for the patient by reducing the cost and increase the interaction with the patient in a positive way. So I think the opportunity for connected IoT devices is tremendous, but the opportunity is tremendous when you connect the IoT devices literally to the EMR and to the doctor. It has to be fundamentally actionable. If it isn't actionable, it's just data. And right now, healthcare is drowning in too much data and very poor applications of data. So what we structured is a $10 million convertible bridge note that basically pays a 12% sort of interest. We expect it to be out no more than 2 years. My personal goal is to get it converted by the end of the year into a larger round of at least $25 million. And here's one of the things that we're doing that no other company can do. With every one of those investments, we're going to gift per $250,000 investment, 100,000 shares of common, obviously restricted shares in each one of our 5 companies, because this solidifies what is our philosophy, that we're going to create a hybrid. It's not a venture capital firm. It's not just an incubator. That's not private equity. And certainly it's not sort of a mutual fund that is going to be innovative in new technologies and expand those technologies for opportunities to our shareholders. And by the way, we also are confident that we will build company 6th, 7th, 8th, and 9th because we know how they plug into the system. This is what 30 years of experience in healthcare has provided for us. So we're very excited. Here's our use of proceeds, which is really to basically get us very much, as a friend of mine likes to quote, get us on the runway to begin making those contacts with acquisitions that we already have sort of in tow, signing letters of intent, start looking at the real estate that we have looked at and bring it in under some kind of a contract. Obviously spend a lot more money in our technology, in our blockchain, in our EHR, and bring in the rest of the management team that's going to take this company to what we believe is going to be dramatic. And here's dramatic. Dramatic is we believe that we could be at 5 years at $1 billion run rate, and certainly profitable. One of the things that I'm disappointed by seeing the IPO from Oak Street is they're doing about $800 million, but they're losing money. And I think we are confident, forget about think, we're confident we will do it better, faster, with better return. So here's our big deal. We've got a management team that's used to working together, that has worked on numerous projects together with a lot of seasonality. So that's part of the value that we're bringing to the table. In our DVP model, our exit strategies are many. And I've sometimes been told to make it simple. This is not, healthcare is not simple. This is a really exciting deal because we can spin off our individual companies. You know, we heard me talk about sort of Livongo and Teladoc. It's possible. We could also be acquired by managed care companies. I can tell you one of my companies historically was acquired by a managed care companies. There could be aggregation of companies, whether it's venture capital or private equity. There is certainly an opportunity, not my favorite, about looking for a SPAC when we get the size and girth. My favorite, or certainly not excluding 1, 2, and 3, is an IPO. And the reason for that is in our acquisition of the doctors, part of their acquisition compensation will be equity in our company. So we want to create that kind of innovative company that also rewards our acquisitions and our employees. And I can tell you, I've done this so many times that I sort of lose count how many times it's been done. So we believe that we will start having potential liquidity events, certainly within 2 years, maybe as early as within 12 months of the final funding of this project and this company. So with that, about 25 minutes, we're ready to answer any questions that you may have. The questions will be monitored and will be discussed by Carl and Greg also online. Thank you very much for being here and listening to our presentation.
Thank you, Noel. Again, everyone, please use your questions chat option on your screen to submit over any questions that you have for Noel, Greg, or Carl.
Great. Thank you, Lindsay. So this is Greg, and I'll moderate the questions just to keep it flowing. So Noel, first question that's up is, this seems rather complex. Why not just one entity?
Well, the reality is that healthcare is complex. If you ever walk into, whether a doctor's office or a hospital, it is a complex industry. And the problem with simplicity in healthcare is that the buyer, whoever pays, is very different. Let me give you an example. You have 5,000 hospitals in this country. 4,000 are non-for-profit, 1,000 are for-profit, and they're composed of very complex systems. They're composed of of emergency room, they're composed of radiology, they're composed of laboratory, pharmacy, they're composed of sort of housekeeping, they're composed of outpatient. It is complex. So it's not that we're trying to solve doctors or hospital. It is a complex system. I am 100% confident that the technology is fundamental to creating value for the industry and for society. And I'm 100% complex that you have to provide services with technology and technology with services. But a better example, and I'll hand it over to Carl, is to talk about a perfect example of Federal Express. Go ahead, Carl.
Well, yeah, thank you, Noel. Interesting. Everybody thinks of FedEx as, the little truck that comes up to your home or your business and picks up a package and off it goes and ends up somewhere at the other end where you want it in 24 hours. What people do not understand is the huge logistics network behind that. FedEx, really the largest package courier and delivery service in the world, 280,000 employees. They have almost 700 aircraft, 73,000 vehicles throughout the world, and they're picking up and delivering packages at the rate of 6.5 million per day. Now, when you look at their organizational chart, you might say, wow, that's, that is pretty complex, but yet they've broken it down in a very similar way to what we did with their captive companies, their HR, sales, communications, support services, and then the operational elements of their air freight operation, their package, ground package delivery, the nationwide carrier service, the trucking company, and warehouse and distribution, where they do the sort and distribution. So what they have done is very similar to what we have done. And the other thing I'll note for you is up in the top right-hand corner, the patents that they have. They have patented a number of their processes, much in the way we have. So, we're not denying that there's a certain level of complexity, but to everything that's done, that complexity can be simplified and operate. And we have to admit, FedEx does a great operation. So, Noel.
Thank you, Carl.
Great. Thanks, Carl. Thanks, Noel. Question about competition. Who is the competition?
Sure. I mentioned a little bit about the competition sort of in the MSO space, which you have, Oak Street that just went public. The valuation of Oak, last time I looked, it was about $9 billion. So that's about 10 times revenue. That is about $120,000 a patient. That's the only company that I'm aware that's sort of in the managed care space that's public. There are many that are private, many, certainly about half a dozen in South Florida. But even as I said, the market opportunity is about $300 billion. They're one of the largest that's sort of independent. They're around $1 billion. Now, also, you have to recognize that there is competition from the industry itself. For example, Humana, which is a company I know very well, has 5 to 6 MSOs that they've acquired, including a company that I founded. So they're probably doing $3 or $4 billion today. So there's a lot of competition, but I would urge you to first not discount it, but also understand that when all of these companies that you're looking on the screen right now in the managed care side, all of them combined do not have $10 billion of revenue in an industry that's 3.7 trillion. You could say there's a lot of competition. There's a lot of blue sky. On the right-hand side, you'll see a little bit of the companies that I talked about, EMR. You have Cerner, Epic, eClinical, McKesson, that are generally the most profitable around in the space. You have lots of other that are providing technology solutions. We talked a little about Teladoc. Last time I looked, they were still burning money. So there's a lot of opportunity, especially that I can tell you that none of those companies own their own practices, own their own doctors, own their own delivery system. And that's where I think the future is. On the left-hand side is one of the most interesting companies, why, and I'm not here to promote them, is Walmart. Walmart has understood that you cannot change healthcare without touching the patient. So as of the last count that I read, they were either building or operating about a dozen medical centers inside Walmart. The the opportunity for us is that they're almost all of their work is done for fee for service or patients that pay for services and time. So they're not in the managed care space. In the real estate, almost everybody is a competitor. Real estate is one of the oldest industries on earth. So you've got CVS is converting some of their clinics or some of their pharmacies into clinics. You obviously have hospitals, and you heard me talk about 5,000 hospitals in the United States. And then you've got some of that are sort of a little bit out of the norm, but it is possible. I'm still sort of surprised why WeWork hasn't gotten into healthcare, other than it's a complicated industry. And in blockchain, you have dozens of companies that are sort of using some kind of distributed ledger for healthcare. The reality is almost none of them are involved in healthcare on a day-to-day basis. I call them opportunities, and they're great for following. So what we bring to the table is a comprehensive solution to, at the end of the day, providing care. The only way to change healthcare, and frankly, the most secure way of changing healthcare is providing care to the patients. And I don't know if somebody's going to ask the question, but over the last 2 weeks, we've seen the earnings of 3 private companies and 1 non-for-profit. Kaiser Permanente had a record profit in last quarter. Actually, thank you, Carl, for putting it up. $4.5 billion, 180% over the year to year. United Healthcare had almost 100% profit increase from the previous quarter. Anthem was 100, and Humana was 98.1. Now, if we go back to that other slide, there was no technology company on the right-hand side at all, anywhere, that can tell you that their revenues. Teladoc had an incredible quarter, absolutely, but they're still losing money. But I'm talking about profits, not revenue. Those HMOs were profits. So we are comfortable, incredibly comfortable, being in the managed care space, because in spite of what happened with the pandemic, those companies continue to make record profits. We don't expect that to be forever, but they're always going to be profitable. I'm always going to pick the payer side because they're always going to be profitable. So that may be more than anyone wanted to hear, but hopefully it answered the question.
Thanks, Noel. The next question's about revenue. So, Carl, maybe you could put up the slide that's got the revenue breakout by the companies. Question is, how does the revenue break out of that $1 billion into the individual companies?
Well, the great thing is the revenue is broken up. The number one revenue generation is going to be our MSO, or what we call TCA, Total Care America. Without question, without doubt, as I have said in the past, and I didn't say at the beginning here, is the first 500 million is easy. And honestly, to a certain extent, that's what Oak Street has talked about. The second one is going to be real estate. And here are the projections that we have going into the platform. I am confident about the MSO projection. I'm incredibly confident about the real estate projection. The others, when you use about technology, especially as we switch those technology to either an access or a shared savings, the EMR industry should be taking risk by providing the technology. If the technology cannot reduce the cost of a patient's care, then why do we need it? So here's our 5-year projections. I can't tell you they're all conservative. They're certainly not exaggerations. That we're confident that we could be a $1 billion aggregated revenue company in 5 years after the funding is done. The first 500 million, you could quote me, will be the easy part.
No, a follow-up to that is the interconnectivity between the revenue and the companies.
Well, the company, as I said in the presentation a little bit, are sort of interconnected by design, sort of my description of the hospitals. So if we bought, let's say, 50 medical practices and kept them in 50 locations, I can tell you from experiences, we don't create very little efficiencies. It's not a financial modeling. The average actor has 2.7 employees, as you heard, 2,000 square feet. They have incredibly inefficient. I have bought over time, many times, multiple doctors and aggregate them together. Sometimes there's an optimum, by the way, the number is between 6 and 12. After that, it becomes a problem. So our idea is to literally acquire these doctors' practices, move them into locations. And the reason why it's important is we want all of our locations to have the same feel. So that's why there's tremendous amount of real estate available. So the healthcare acquisition and management company will be tied at the hip to the real estate company, and we're going to be projecting. So if we buy a doctor's practice today, okay, I'm going to say within 2 years, we need to have a location in the nearby community to merge that doctor in. That's the plan. The technology is fundamental, as I said earlier, because that's the way we're going to be a change agent to both the patient and the doctor, is by bringing that technology. So the technology is part of the grafting, both at the real estate level, because new doctors are going to come and need the new technology, but also from the MSO delivery system environment. So today, as Carl talked about, FedEx is a technology company. They don't talk about sort of that technology part is separate. And by the way, a lot of their patents are about technology. So yep. We're now seeing healthcare in a holistic view and the way they fit together. The same thing with IoT. We connect the patient IoT, we'll be able to know what the patient condition is. Something as simple as this, which is an oximeter, okay, can tell us if a patient is having problems today, so they can either go see the doctor or they can go on telemedicine. Our number one goal is to keep the patient out of the hospital, so we want to keep them healthy. So the IoT is fundamental to our business and our business strategy.
Okay, thank you, Noel, thank you. Question on managed care side. In the managed care offering, will you manage Medicaid MCO and dual eligibles?
Wow, that's a great question. Somebody knows. The answer is yes. Okay. The reality is that about 33% of Medicare beneficiary are in managed care programs today. Medicare is praying and hoping that that number increases. I believe that it will be either at or close to 100% by 2030. If we have a change in philosophy and we expand to healthcare, I think it'll be bigger. Dual eligibles, and I will explain this a little bit to the people that may not have heard the term, are basically individuals that are beneficiaries of both Medicare because they're over the age of 65 or potential disability, and also have access or have qualified for Medicaid. Usually, they are not only our elderly, but our eldest, but the people that are most vulnerable because of what is generally now discussed or the social determinants of health. Those people are both a tremendous challenge for society, a tremendous challenge for Medicare, but also a tremendous opportunity for what we're talking about, sort of that interactive, I don't want to say in your face, but really proactive patient engagement. So absolutely, dual eligibles are a great challenge for the society and a great financial opportunity for us. And let me tell you, I have operated centers in literally the poorest communities in Florida that are struggling. So those people need a lot more active care. I happen to speak Spanish fluently, better than my English. And those are generally the type of people that are going to need that care. So you're going to have African American communities, you're going to have Hispanic communities, immigrant communities at large are going to need that care. So I welcome them, and we will treat them all with the absolute best care they've ever witnessed in their life.
Great, thanks, Noel. Carl, perhaps a question for you about telemedicine. How does telemed fit into all of this and IoT also?
Well, it's huge because what we've seen in COVID is the hospitals, what is referred to as hospital surge, people rushing into the hospital for treatment, yet so many people not needing to occupy a bed, just occupying the bed because there was nothing else for them, nowhere else to monitor and watch their progress. Through remote patient monitoring, those people can be sent home, and we can actually create what could be an extension of the hospital in their home environment. So as we've talked about and Noel mentioned before, the remote patient monitoring enables us to, it provides us the ability to empower those patients and provide this window of care. With the EHR combined with the telemedicine and remote monitoring devices, we create what we call a golden triangle. We've got patients that we can monitor, whether they're recovering from an illness, or they're recovering from surgery, or they're just at near end of life, or in that higher elder age where they need to be monitored, and they're part of the Medicare Advantage programs. Uh, we're enabling the providers so they can see their patients and deal with their patients, and we've taken the technology and we've advanced the science. So, yeah, the technology and remote monitoring, all of those capabilities are fundamental to what we want to do to reduce cost, bring the quality of care up substantially, and be able to uh, treat people without a lot of hospital visits, without a lot of even in office provider visits. So we're advancing the technology and bringing the technology to bear where it's needed, not just for the sake of technology.
Okay, thank you. Noah, I think back over to you on this one. It's about the patent portfolio. How do these patents give you competitive advantage and protection in the marketplace?
Well, it does a few things. First of all, it tells our investors that we as individuals are innovative and can prove that innovation. One of the things that I found the most interesting in reading the 277-page S1 from Oak Street was that they did not talk about patents. They basically said that their technology probably wasn't patentable. I think patents are incredibly important. We just got our patent for our EHR component. Now, all EHRs are not patentable, and our patent has to do with a specific way that multiple doctors can access the record at the same time. By the way, that's a big deal, obviously, to have patented. I think our IoT patent is really fascinating because what it does is we will not build a device. I cannot envision a scenario, never say never, but I cannot envision a scenario where somebody's going to convince me to create one of these devices. What I want is the data from this device. So our patent is literally about taking devices like this, aggregating them, using artificial intelligence and obviously machine learning to then determine whether that patient baseline is correct, and then eventually uploading it to the EHR and to the patient, to the doctor, so that if nothing is wrong, the information is captured and is there as a baseline. If something is wrong, then it will alert the doctor and the care team and even the patient that they have a problem. We think innovation is what's going to change healthcare. We individually, and most of these are my patents, or at least I've collaborated in them, if they're not mine. We're going to continue to innovate. We have licensed as an entity all of these patents from what was our original, basically originally our founding or our parent company, and they still have 19 patents going. I think the number may be 20 now. So we think that it goes back to our philosophy. After being here 30 years, I've seen service without technology. I've seen technology without service. I've seen them sort of try to work together. In order for us to change healthcare, we have to not only merge the technology with the delivery of care, we have to change the way doctors are paid. By the way, we built that model for that. And the way the patient is treated, by the way, as a consumer, not a patient. That's one of the problems that we have in the healthcare industry. I remember giving a speech in 2008 that we in the industry were not seeing the patient as a consumer. And in that, by the way, in that speech, I also talked about that my Lexus got better access to technology than I did 10 years ago. So we think that it's fundamental. In order for us to be a change agent, innovation has to be fundamental and key. We have these patents protecting us, and we have more patents that we will be pursuing in the future.
Okay, thank you. Couple of questions. There's a couple of questions about the actual investment, which I'll tie together here in a second. First question before that, though, is why hasn't this been done before?
Well, here's a challenge, and Carl's going to smile when I say this. You can't take 30 years of experience, and put it in a 25-year-old body. And healthcare is incredibly complicated. It isn't flashy. I think we're flashy, but it isn't. It takes a lot of experience, a lot of knowledge. You have to have sort of knocked your head around a long time. I can tell you what models in healthcare acquisitions work and what's not, in part because of the experience in watching companies that I work for, including, Ficor and Med Partners, lose billions of dollars by acquiring doctors wrong and not understanding technology. I've certainly worked in the technology side. I've worked with TPAs. I've worked with insurance companies, worked with providers. You need this holistic approach. And the reason why it hasn't been done, I just told you, go back and read, and I hate to put them an example, but it's a really good example you can find very quickly, is you've got a billion-dollar healthcare technology company, a healthcare service company that basically doesn't talk about technology other than it provides scheduling and some optimization. That's not technology. Again, my truck gets better technology than we use in healthcare. So that's why it's hard. It's also hard to convince people that we have to provide care. It's really exciting to go out there and maybe there's an interesting conversation about why Teladoc and Livongo sort of merged together. But we have not changed healthcare with billions and billions of dollars in technology because the doctors can't use it, the hospitals can't change. I mean, think about this, and this is a really stupid comment or problem. It's not a comment. The original EMR, in modern EMR, was designed, and the acronym is basically from Massachusetts General Hospital, and yet there's not a single hospital in the United States today that has their own EMR platform. They have Epic or Cerner. So you have these silos that have existed, and I think we want to change that. It's really hard to get experience because let me go back to this company that just went public. They have 58 medical centers. They have 58 leases. They don't own the medical centers and the real estate. Let me tell you something. I've been around real estate because of my family, because of my business, since I was still in college. So I understand real estate. I understand construction. So part of the reason why this hasn't been done is because you have not been able to put together the three people that are on this telecast and the technology, the experience, and the resources that are on this slide. That's why it hasn't been done until today. We're here to do it.
Great, thank you. So over to the investment side. Couple of questions. First one, and I'll ask the second one if you don't answer it. First one is, what am I investing in? When do you expect the bridge to be done, and when do you expect to start the A?
When do I expect? What was the last part?
When do you expect to start the next round, the A raise?
Okay, so Carl, you want to go to I think the next slide? Talk about the sort of the deal right there. So the way we put this thing together is that we want to use this money, as I said, to acquire the people and personnel that are literally in my Rolodex, or I guess in today's case, they're on my iPhone, to bring the team together. We have talked to sovereign funds, very large family offices, and large investors about potentially interested in the second round. I will make you this commitment. The minute we close this $10 million bridge, not only are we going to bring in the entire team that we've designed, I would say, besides notice and opportunity, within 60 days, we will begin doing LOIs with doctors within 60 days, and we will be going back to the marketplace for let's call it officially the A round or the larger round, literally the next day, because we're going to engage them as to what we're going to do, and we're going to show them as we do it. I can tell you this: we took a company from zero, an idea, a piece of paper, to 100 million in 4 years, and I guarantee you I could do it faster and better today. So our goal would be to begin the fundraising of sort of the A round almost immediately, certainly within 30 days, so we show some momentum, and LOIs of acquisitions and LOIs for acquisition of real estate. I would be disappointed if we didn't close it by the later part of the fourth quarter of 2020 or the first quarter of 2021. So the 2 years out there, because things happen, and we don't want the advantage in negotiating with the investors for the 25 to 200 million dollar round to have leverage over us. If they know that we've got a 6-month bridge, they can wait us out 2 or 3 or 4 months. And by the way, I tell you that only because it has happened to me. So that's experience. So we put a 2-year horizon so that no one comes to buy and says, we're interested, and all of a sudden we're dragging along 3 months down the road, and now we've got 90 days before the bridge supposedly matures. So I make you a commitment to whoever's on the phone, and I guess it'll be recorded. Once we get this financing, we will bring in the people on board. We'll have LOIs within 60 days, and we will be on the street trying to raise the minimum of 25, which is what the document says, or 50 or 100 million round. One of the things that we have, and this is why I'm super excited today, is it was really hard to explain sometimes to people what we're doing because it looked like we were sort of a little bit of this, a little bit of that. We're not. And the perfect example of the opportunity is sort of what I talk about Oak, which is OXIO, the New York Stock Exchange. Great company, great people. I don't know them. But they showed that a company can go from effectively zero to about $1 billion in revenue in 8 years. You know what? They took a really, really long time to get to $1 billion. We will do it faster and better. And you know what? If we get to $800 million in revenue, and we haven't been profitable for years, you could call me personally because I would be sorely disappointed. Because at 100 million, okay, the MSO should be profitable, actuarially profitable. So that's my commitment. That's what we're going to do. I hope investors will be in this thing a very short time. We are making the deal better. Carl, can you go to the next slide? And we're saying our DVP model is, by the way, by itself revolutionary. It took a lot of legal work to structure it and to make it work. We're going to give all those investors per $250,000, 100,000 shares in each one of those 5 companies, because I believe that within 2 years, at a minimum, one of those companies will be acquired or merged, and you'll have literally an opportunity to sort of cash in the investment you're going to have here. Plus, we as a company will be able to cash in and redeploy that resources. So it's all about exit strategies for me. It's all about diversification. But what we're not diversifying is our business model. This model goes forward, understanding that services, real estate, technology, and innovation are tied at the hip.
Great, thanks, Noel. You answered the second question, which was about the subs, so investments in both the parent and the individual portfolio companies. So thank you for that. Last question is relative to COVID and how has COVID impacted the business?
COVID, we were already on this path. We were already on this plan. We were already moving forward. We thought that this was an incredible opportunity, incredible time. What COVID has done is it has put everything in hyperdrive, okay? And let me give you an example. Right now, I could buy doctor's practices today for zero money down from zero investment with 100% earnout. But they need me to manage their practice. They need me to help pay their bills. And it will be sort of a return to baseline. There's no question about that. So right now is a tremendous time to be acquiring practices. I would like to acquire 20 practices by the end of the year. It is very possible we could acquire 20 or 40 practices, depending on the team that we have and depending if we have raised at least a chunk of that $100 million. On real estate, I don't have to tell you that right now, retail stores, freestanding buildings. Now, by the way, that's fundamental to our philosophy. We want to control the real estate. We want to control the signage. We want to control the parking. We want to control everything. We want to make these the greenest buildings in healthcare you will ever see with solar panels in the roof. So we have to control the real estate. There's today real estate available everywhere. We showed you a slide in the presentation where there were 4 pharmacies that would close that are perfect for our model. Those are all within 10 miles of our office. We think there's a lot more. By the way, there's a number of Pier 1 locations that I'd love to acquire, perfectly located. So the real estate has created a literally windfall for those with both the capital and the opportunity to use the real estate. In the EMR space, it's actually created an opportunity for us in 2 folds. One is those doctors that are closed today or surviving with the nickels and dimes that telemedicine offers them are going to have a problem in meeting all of their bills. So I predict that you will have some major EMR companies either be acquired for pennies on the dollar or literally closed because the doctors can't pay for them. And on this other side of that, with the telemedicine, it provides value to our doctors and our real estate. We do not believe that telemedicine by itself can ever be profitable. And the reason for that, I explained to a group yesterday, had to do with the cost of the doctor itself. The average doctor, primary care doctor in the state of Florida, is between $180,000 and $225,000. In New York, it might be a little bit bigger, a little Chicago, but there's a finite amount of doctors. So you cannot get a doctor for $75,000 or $100,000, and you cannot export a doctor sort of interaction overseas. So we think there's a tremendous opportunity for us in the technology space. So the reality is COVID is a tremendous opportunity for us that will last at least through the end of the year, maybe well into 2020, where we want to acquire the doctors and acquire the real estate, and 2 years from now be merging those doctors into our real estate. I hope that is not too much or too little. Carl, Greg?
Oh, oh.
That's great. And I think we're pretty much out of time. So thank you, Noel. Thank you, Carl. Noel, back to you if you have anything else, or Carl for closing questions, and then over to Lindsay.
No, I appreciate everyone's time.
Yes.
Apologize for the backgrounds. We normally do this in our offices, but somebody decided to rip out our cable in a construction job, so we're doing it from our homes. Thank you very much.
Gentlemen, thank you so much. Fantastic job. Thank you for sharing OXIO Health with all of us today. On behalf of Family Office Networks, to all of the attendees, thank you so much for joining us. I will be following up with all of you individually, so if there are any other questions or feedback, we would appreciate it. We look forward to connecting with you all shortly, and we hope you have a great day. Thank you.